Thank you all for coming. All right, we are boosting up already. We have, I don't know, 800 people. I hope, most importantly, that I look good to all of you, because if I don't look good, you don't look good. So I think the lighting's good. Hair and makeup was not possible in COVID, and all of you look very comfortable in your underwear with popcorn over there. Unfortunately, I cannot see any of you, but I hope you're out there and you're smiling, because I am sensing all of you. And this is my first webinar ever, and a lot of you know me. Hopefully some of you don't know me and will get to know me. Some of you are patients of mine, and some of you are just used to seeing me on Instagram. But I have a lot to say, and there's a lot out there in terms of content, in terms of non-invasive rejuvenation, particularly of the face. If this is successful, I'll do another one of the body another time. But there's a lot out there, and aside from using this as a way to learn about how to do a webinar, I thought it'd be great to kind of embrace my audience and tell them a little bit about me. Now, some of it is going to be repetitive for people that know me, because if you know me and you're a patient of mine, I got a lot of spiel and I have a lot to say about everything. But I'm going to try and go through the overall gamut of my kind of ethos. A lot of you out there also may have had work done before. Many of you haven't had work done before, and I'm going to try and give you a new angle on everything that you know about. I do want to do some fun things as well. I have a couple of polls that I want to do. I would love to hear if you could go into the little chat section and let me know, where you're from. Are you from Mars? Are you from California? Are you from New York? Please say hi. I welcome all that. I'm going to save your questions for the end. A lot of people, hey, what's up, guys? Look at that. There are a lot of questions, and I want to get to a lot of them. We're going to take more questions on here. I have a bunch that were emailed to us, and I also got a lot on social media, and they're good ones. So I'm going to go over them all. The first thing I want to try and do, because again, more and more people are coming on. We got a few hundred now. I want to do a poll. Okay, a little fun poll. Let's see if we get this right. So I'm going to hit the poll. Okay, and I'm going to launch the poll, guys. I'm going to launch the poll, and you're going to have the opportunity to answer it, and I'm going to post it. Okay, so let's try this. And the poll is what I predicted. People are running for Botox. That's the most important thing. I should have put at the end all of the above. Because I am getting calls for that as well. I do have another poll that I'm going to show you later on down the line. My feeling is people are going to come in and they're going to want their injectables first, because those are kind of like the quick fix things, which I'm going to go into future. And then we're going to start thinking about things that maybe have a little bit of downtime. People have time for downtime now, so they'll start thinking about things like Fraxel. All right, guys. I am going to first very briefly talk about my book, and it's not to overplug it, because in all honesty, I do that enough on social media. I do have a book coming out on July 7th. It's July 7th. It's pre-launch now on Amazon and Barnes & Noble. It's called The PRO-AGING PLAYBOOK, Embracing a Lifestyle of Beauty and Wellness Inside and Out. It's my second book. I haven't written a book in like 15 years. I'm really proud of this because, again, if any of you know me, I really believe beauty is an inside and out thing. There are a lot of amazing contributing writers, Tanya Zuckerbrot, Donna James, who are amazing dietitians, David Rosenberg, plastic surgeon, renowned plastic surgeon, Michael Appa, cosmetic dentist, Georgia Louise, celebrity esthetician, my own microblader and a celebrity esthetician, Christopher Drummond. It's a motivational book. It's a holistic book. It's an inspirational book because, again, if those of you that know me, I really view what I do and what any of you may get done in terms of cosmetic dermatology as icing on the cake. There is absolutely nothing I could inject in you or put on your skin that will do as much for the aging process and being the best version of you than diet, exercise, sleep, stress management. And, you know, aside in my book of giving all the latest tricks, of course, I'm not going to leave out all the greatest technologies and how I like to put them together and how to find a provider and the hottest skincare technologies. Of course, I go all over that. But I really want to help motivate people about their perspective of aging, because guess what? No matter what I do, and I've had patients that I've had for 20 years now, no matter what I do, you're not stopping the aging process. And, more is not always better. And we do have to age, and we have to look and sometimes, unfortunately, feel age appropriate. So I need to be a little bit of a guidance counselor for people. And if I can't do that 100% with injections and lasers and liposuction, all that things, I have to do that on an internal level and to help guide my patients. So I hope that this book is going to really be a resource, because we know that beauty is always in between the ears. I tell this story all the time. I have supermodels that no matter what I do to them, they feel ugly. And I have 92-year-old patients that you wonder why they're doing this type of stuff, but you know what? They feel beautiful afterwards, and it makes them feel good. So many of the themes in this book pertain today more than ever, because the themes are not just about about how you look. They are about how you feel inside, about your vitality, about your sense of self, your self-image, and the way you project yourself to other people. Because no matter how beautiful you are, unless you feel that inside, people are not going to treat you any differently. And I really think that I, as a physician, have to be part of that for all of you. Patients come to me and they say to me, Dr. Frank, tell me what I have to do. Tell me what I have to do. You have all these things. I don't know. Tell me what I have to do. And I say, you need to go home. You need to look in the mirror. You have to take stock in all the blessings you have, particularly your health. Appreciate, make the best of what you got, and be satisfied with how you look. And then the next thing I say, if that's not good enough, I got tricks for you. And that's what we're going to go over today. We're going to talk about the tricks. So Pro-Aging Playbook, hopefully you guys will take part of it. You're going to hear a lot of it down the line. And I think that's it. So on to treatments. I'm going to start for beginners. You guys have to tolerate just a little bit. When do you start? People always want to know, where do they start? And I always tell people, you start when and where it bothers you. I'm a cosmetic dermatologist. I'm not a plastic surgeon. I rejuvenate. I don't really recreate. Sure, if you were born with certain hips, I could reshape your body. I may be able to give you lips and cheekbones that you may not have had before. But really, my goal is to make you look and feel like you did years prior. So a lot of the treatments I do are better young, which is why the younger population, a third of my new patients are in the millennial category. And it's always best to clean up your room before it starts, before it starts to get dirty. That's one of my favorite PFRANKMD isms. Clean up your room before it gets too dirty, because little things will go a long way. And what happens is, it's unfortunate if I have a 65, 70-year-old patient who comes to me for the first time, they've never done anything before. Sure, there are things I can do to help them, but there are limitations because I'm not going to overdo it. And that's someone who may need more surgery. There is no doubt that what I can do can put off surgery, avoid it in people with certain expectations. And we'll talk about options for surgery later, but do things when they start bothering you. I don't do things prophylactically. 19-year-olds that are coming in for Botox and fillers unnecessarily, I'm not doing that. There are people who are doing that. And the next real question is where to start. This is a big, lengthy discussion. Most of I talk about this all the time, and most doctors will say you could only go to a board-certified dermatologist or plastic surgeon. But the fact of the matter is, you shouldn't be shopping on Groupon or finding the best deal in a coupon folder, or just looking for the cheapest deal. You really have to make sure that the person has expertise in what you're doing, preferably a board-certified physician, physician assistant, a registered nurse, where there's appropriate supervision and training. And you got to feel confident what they're doing. This is your face, kids. 10% of my practice is fixing shit, okay? And 75% of the time, that fixing shit there's a story behind that. And it's even been on my own patients who have, their cousin's brother's sister did it for free on them, and then they've come back. And so just be smart in picking your provider. The other thing I like to say to my patients, which I think is true for newbies or people who've been around a while, is you have to remember the things I do are a form of grooming. There's no one and done, okay? There's absolutely no one and done. You have to commit to grooming just like you do with your hair, just like you do with shaving or makeup or things like that. Now, that doesn't mean you have to live in my office or get these things nonstop or have it be abusive. But aging is a progressive disease. And, our body's changing. We have to change the way we work out. We have to change the way we eat. We have to change the way we sleep, meditate, do all these things. And I really like to look at cosmetic rejuvenation like that. And like I said, I've had patients for like 20 years. Every few years, I have to change gears. The things that work now on that 50-year-old, when I was seeing them, I can't do what I was doing on them when they were 35. The good news is that I'm aging with my patients. So I'm practicing on myself first, any new technologies. But again, it's about perspective, and it's about looking at these things as a form of grooming. Now, there are technologies where I can make permanent differences. But again, I'm turning back the clock. I can't stop the ticking. So when patients are like, "What? Oh, someone's raising their hands already." Okay, save the questions for the end, guys. I promise you, I'm going to get to many as possible. So I really like to teach people, and I want people to feel comfortable because there are so many safer procedures out there now. And I think the younger generation is really looking at this as a form of grooming. Now, in terms of prioritizing treatments, this is a very important topic because this is true before COVID. It certainly is now. Everyone thinks that all my patients on the Upper East Side are fancy Fifth Avenue ladies at lunch, but it's not true. I have an international clientele. I have a very wide socioeconomic population. I have people from every suburb, every part of the city, every part of the world. And I've got school teachers and cops and people that save up for their treatments. So, it's very important that any provider you go see is honest in prioritizing treatments for you. Very important, particularly in the new world that's to come. You may not be able to do everything. You may not be able to afford everything, and you may not be a candidate for anything. So I think it's very important in how you prioritize things. And I talk about this all the time too. You have to make sure that you're not just being sold one thing. You have to go to a physician that has a full palette, because it always has to do with the artist, how you combine things, how you do things. So if someone's pushing a hard line for one thing or one brand of filler or one type of Botox or one type of laser, it's generally because they're not experienced or don't have the other things. So you want to make sure that the provider is not just selling a hammer, because if you only have a hammer, everything looks like a nail. You don't want to be that nail, okay? But in terms of prioritizing treatments, my ethos is I always focus on skin quality. Let me take a little water here. I always focus on skin quality, and I don't care how much someone has to spend or anything. I know a lot of people, they may come in, first of all, they want their Botox, their filler, they're a new patient. Of course, I understand people want their quick fixes. But to me, youthful skin is clear skin. And I know no matter how I try, no matter how much Botox or filler I'm going to put in your face, you're not going to get rid of every wrinkle. But if I get rid of your sun damage, your broken capillaries, control your rosacea, improve your acne scars, improve the texture of the skin, tighten it up, these are things that are going to make long-term differences, so that even if you look age appropriate with a few lines, you're going to look great. Because if you look at older models or people airbrushed or things like that, it's not that they have no wrinkles, it's that they have clear skin and vital skin. It shines, it reflects the light differently. Treatments like Fraxel, V-beam laser for capillaries, energy-based microneedling for acne scars and skin tightening, Ultherapy, Axillus, other types of things. These type of treatments, they'll make differences that A, could be permanent, B, don't take a lot of maintenance. Sure, you can get one Fraxel and you may want to do it once a year or once every several years, but the effect of that Fraxel doesn't wear off like an injectable does or certain things. So to me, clear skin is beautiful skin, and I always push it. I know my patients out there, you're saying to yourself, oh God, shut up with the Fraxel already. He's constantly trying to get me to do more Fraxel. And it's just because I believe in the technology. I do it every year myself. And again, it doesn't have to be name brand Fraxel. I prefer that brand. There are other types of fractional resurfacing lasers that are out there. But again, I like to make long-term differences for patients, and I like to combine things. So I think that is, going to be very important. Let's see. The downtime with the downside of these treatments, though, is that they're not as immediate. Sure, some of them may have recovery, some may not. but it's more of a cumulative thing as opposed to the quick fixes that of the injectables and things like that. There's no best technology out there. Again, a lot of them, they all do different things. You're not going to find one machine that does everything. Does any doctor that tells you, oh, this machine will remove your capillaries and your brown spots and tighten your skin and improve your acne scars and do all that, these are jack of all trade devices that are masters of none. And a lot of med spas, maybe general dermatologists, or like people who don't even, other board certified doctors and other things that are just trying to get into the cosmetic game, they'll buy this like all-in-one device that supposedly does it all. Is bullshit. Okay, you really need a lot of different technologies to accomplish a lot of things. Again, jack of all trades, masters of none. The lasers I have focus on specific things. I often could do them at the same time. And yeah, some are more versatile than others, but there's no best. You need to have it laid out. Again, the hammer, the nail, all those things. Now that we're talking about skin quality, I'm going to very briefly go over skincare. I'm not going to go into depths about it. I go over this in my book. I will preface this that I consulted for Estee Lauder and was involved in product development for 3 different brands in those 3 years. I helped co-develop Madonna's MD&A skincare line. I've been in the skincare industry for a while. I know what goes on beyond closed doors and development. And there definitely is good skincare out there. There's great value to skincare. But I really like the rule of KISS with a lot of things, and that is keep it simple, stupid, especially for patients that are spending money on injectables and lasers and all these things. I guarantee you the only product that makes an enormous difference is sunscreen, because 90% of aging is sun damage, okay? A lot of people out there are spending a lot of money on skincare. They're not even wearing sunscreen, and they have complicated regimens. They're mixing things up. They're not consistent. They have sensitive skin syndrome. And again, if you love skincare and it serves you and you feel like you see results, that's all I care about. God bless you. You know, in terms with the pricing of skincare too, you're buying a lot of other things when you're buying skincare: packaging, aspirational stuff, psychology, feel, smell, all these different things. But what I'm telling you is that although there is good value to skincare, it is not the must. And I think a lot of people stress out about their skincare. Keep it simple, stupid. If you have a skin problem, see a dermatologist. But a lot of people, they're just experimenting at home. And they're just throwing preservatives and different ingredients and trying different things. And all they're doing is creating havoc on their skin. So when a patient comes to me with 20 different products, I open up the garbage can and I throw it out and I start from scratch. And again, simple things: sun avoidance and sunscreen. You're like 2/3 of the way there. So, you know, I love being involved with skincare. I love product development. I have my own skincare line. But in a world where we have to prioritize, I try and keep it simple. So I hope I didn't offend anybody out there. But, you know, that's just the way I feel. I like to make really home run type results. Even with, you know, retinoids. Retin-A is the only FDA approved anti-aging skin product. You know, if you use it for 20 years, great. You're going to do great. That and sunscreen, that is the best thing that you could do in your life. But a lot of these things ain't going to do what one Fraxel is going to do. Okay. I'm so jaded. I'm sorry. Also, estheticians. I work with a lot of estheticians. I have estheticians here. You know, Georgia Louise, who's a celebrity esthetician, I work a lot with her as well. And, you know, a lot of my patients will ask me, well, do I do their treatments or do I do your treatments? Or do I just do skincare? So that's the common thread: skincare, estheticians, professional treatments. How does this all fall in? The difference is, you know, skincare at home is like brushing your teeth, okay? I would say esthetician treatments are like flossing, okay? Or doing your more advanced care at home. Going to the dermatologist, plastic surgeon, getting these treatments, that's going for your teeth cleaning. That's the heavy duty stuff. Esthetician procedures are non-medical. I mean, I love what estheticians do. First of all, they give immediate effects. If you have an event, if you have that you want to look great for, if you have chronic acne and you need to see someone to help you, or you're just not happy with your skin, esthetician care is amazing. And it could be a great complement to the type of things that I do. So it's not an either or. But, you know, the treatments that an esthetician are going to do, they're not going to give you long-term benefits of tightening. They're not going to reduce long-term wrinkles or sun damage like you're going to get from more medical procedures. So again, estheticians out there, I have such huge respect for your skills. I love working with you. I just try and break it down in terms of, for my patients, how it's going to all combine. Hey, in a perfect world, let's do it all, right? All right, let's move it down, because I know you guys are itching to get to the shots and the other things like that. So let's talk about injectables, because these are your quick fixes. And I looked at my schedule. I mean, people are coming in for their injectables. They want their quick fixes. Let me first go over the verbiage of Botox and fillers, because I don't sell name brands. I don't sell Juvederm. I don't sell Restylane or Versa or Radius. I don't sell Botox. These are neuromodulators, and, you know, fillers. There are 4 different neuromodulators on the market: Juvo, Xeomin, Botox, Dysport. They're all different colored paints. Same with the fillers. One is not so magically better than the other. Some are a little bit more potent. Some diffuse a little bit more. In 50% of patients, I will use more than one neural modulator on the body. I'll use one type here, because I want more motion, one type for sweating. You know, anyone that's just using one, I don't think is, spreading out their skill set appropriately, because I think they're advantage to all of them. The same thing with fillers. In fact, I don't like the word fillers, because there are volumizers, there are line fillers, there are fine line fillers, there are smootheners, there are skin boosters, there are biostimulatory agents. These are the different categories. And I'm not going to go into every single kind, but they are a sophisticated medical product, fillers and neuromodulators. And when people are just saying, I just want some Botox and filler, I'm going to go buy this syringe, or I'm buying one area, or I'm buying that, I understand. I mean, we have to price things a certain way, but I really like to look at it as a more sophisticated way. And I think every patient, whether they're my patient or not, deserves this sophisticated approach. Because what are you actually doing? You are like expressively neuromodulating and structurally optimizing the face. I call this like the ENZO technique. I mean, everyone has their own word. So yeah, ENZO, expressive neuromodulation and structural optimization. I mean, I'm controlling the motions and the architecture of your face. And that's true of whether you're a millennial getting a little bit in your cheek and your lip, or whether you're a 60-year-old and I'm using 7 syringes and a full bottle of neuromodulator on you. There's an art to this, and there's a balance to this. And, you know, when I say the word architecture, I'm referring to actual architecture or design, because when you're doing these things, you know, for every action, there's reaction. You do something here, it's going to affect the way you perceive down here. Okay. You can't just like put cheekbones here and lift up like this. A lot of my patients, in all honesty, I think, I don't know if I take this as a compliment or an insult, but most of them would say is, I don't even know where Dr. Frank put it. And that actually it's a compliment, because all I care about is that they look good when they're done, and they don't look done. And I'm usually all over the place, whether I'm using 1 syringe or 8 syringes or 10 units of neuromodulator or 200 units of neuromodulator. I believe there's a balance in the structure of the face, whether you're 25 for the first time or whether you're 95. And yes, I have a 95-year-old patient who gets Botox and fillers, neuromodulators and volumizers. And, you know, some people come in with a very strict idea of what they want. And I do take requests, you know, I try and give people what they want. Sometimes it meshes with me, sometimes it doesn't. I can't be the perfect doctor for everybody. I have a certain style. Listen, there's no best interior designer, so there's certainly not going to be any perfect exterior designer. That's what I am. And there are some people that go with my ethos and some people don't. Some people want a little bit more overblown look. Some people want it to look like nothing was done. And I think this has to do with the doctor-patient relationship that you really have to find. So, you know, I certainly tell people, don't be bouncing around. Don't cheat. You know, find someone you like. Be consistent. Let them get to know your face, because it's going to change. I promise you, no matter how much injectables you get over time, so your face is going to change and game plans will have to be changed. And it's nice to have a provider that changes with you and knows your face and knows your personality and your pocketbook and how much you bruise and how well you do. with certain things. And, I have patients that are new that I suggest things to, and then I have patients that that are seasoned in my practice. And I would never recommend certain things to them because I just know them, So I think this, to me, is the fun of the doctor-patient relationship. I've told many of you this before. I actually went to medical school to become a psychiatrist. And then my mother told me that, people go to the doctor for something on their skin before they do a pain in their chest. So I figured dermatology was great for me. I was always very artistic, and it just worked out. But I use psychology every day. And I think, to me, this is the fun of the whole thing, finding what's best for someone and then delivering that into the art of the injection. In terms of the type of fillers, again, there is no best. You have the hyaluronic acids. Okay. Again, I have preferences for certain ones of them. I'm not going to go over that. And then you have the biostimulatory fillers, Radius and Sculptra. I tend to use these a lot on the body, cellulite, body modification. I love Radius. I love it for men. Again, these are kind of details that I'm not going to go into depth. I can answer certain questions. Again, I use all of them. If you go to a doctor that is not using at least 2 or 3 different kinds or as an option, like walk out the door. I do use permanent fillers. There are permanent fillers out there. Silicone, everyone still is afraid of, but Silicon 1000 is an FDA-approved product for when you detach the retina. We use it off-label in the skin. We've been using it since the 90s. I've only been in practice since 2000. My mentors before me taught me how to use this. It's still a great filler. I use it for acne scars. I use it for people with traumatic injuries that need permanence. I will use it. I mean, we've used it during the HIV crisis for people with lipodystrophy, extreme hollowness. I will use it cosmetically sometimes. I got to tell you, in all honesty, it's the only filler I've ever injected in 20 years that I've never seen a reaction to. Go figure. But anyway, it's something out there. There are a couple of other fillers that are permanent that are out on the market that I'm not really fans of because of reaction rates. I'm not going to go into that at all. Everyone's common question, I'm sure, in the list of common questions is needles or cannulas. Okay. And, there's no right way. I use needles and cannulas together all the time on the same face. I tend to use cannulas in areas where I'm concerned about safety, bruising, or really getting into fine areas. I love cannulas around the mouth. I love them around the eyes, in the brow. Sometimes if someone has extensive hollowing around here and I need to get into a danger zone, I will use cannulas. But, listen, needles are great. They work. You can bruise a lot from cannulas too, by the way, okay? A lot of it has to do with who's doing it. Again, you want someone who's familiar with both. And again, some people will come in and be like, I only want cannulas used. And I tell people, I believe I'm going to do my best work for you using needles here, cannulas there. And I don't know, I guess I can get a little persnickety sometimes. I like to do what I got to do. But I've been doing this for 20 years. And I think, I have to go by my best judgment. And I usually find some balance with patients because, we live in a world, there's a lot of information, understand. Patients have a lot of opinions and ideas about things, but my job is to give them my opinion. My job is to re-educate them when I can and to deliver the best version of me. Let's see. Oh, you know what? I think we had a poll, right? Okay, I'm going to come back. I want to do one more poll. For those of you that are joining now, I did a poll earlier. That was a little fun. I'm going to do one more. You're all going to be able to answer. I want to see what you have to say. Okay. And there we go, guys. Answer for me if you could. We're going to end the poll. And did this get launched? Everyone can see this, right? And this, again, this is exactly kind of what I thought, looking unlike yourself. Let's see, allergic reactions, injecting to this is how I probably would have answered it, even as a dermatologist, guys. So you're great. Looking unlike yourself is everyone's biggest. I could shut this now, right? That's everyone's biggest fear. I have patients that come in, they're like, Dr. Frank, you can do whatever laser you want on me. I love lasers, but I am so afraid of injectables. Oh, I can't do those. They're dangerous. I don't look like myself. I'm going to look like one of those people. I have other people that come in, they're like, inject whatever you want on my face. Lasers burn you. So again, dealing with people's psychology. And then there are some people that are just like, okay, just give me the whole kitchen sink. Okay. But in terms of not looking like yourself, this is a very important thing. Guess what, guys? You only notice the bad work. And there is a lot of bad work out there, kids. You know, the best work is the work you can't notice. And listen, there are certain parts of New York and California and Miami and God knows where people like wearing their cheekbones like the letters on their clothing and jewelry. But that's not a smart aesthetic because you're distorting the face, you're stretching the skin. Yes, you are putting yourself more at risk. I'm going to make that something about blindness with fillers in 1 second. That question, important question coming up. Yeah, I mean, you can do your skin a disservice. You can stretch it out. Now, I like to reflate skin, not inflate skin. Sure, sometimes you're putting a little bit more in a lip that never was or things like that. You're adjusting the nose, you're doing certain things. But most of what I'm trying to do to rejuvenate people is reflate, not inflate. And yes, a lot of these young millennials that are getting into the fillers and the cheekbones, guess what? They're going to need facelifts at 35 because they are literally ruining the elasticity of the skin. They're causing excessive hydration of the skin. All of these fillers, some more than others, retain a lot of water and give what I call chronic puffy face syndrome. And that occurs even after they wear out. You're putting these kind of hyaluronic acid fillers that are in your face. The point here is that you have to sometimes pull the reins, and I have to say no sometimes. And, you know, it's important that someone thinks about the long term. When I'm injecting someone, I'm thinking that they're going to be my patients for the next 20 years. That's not going on out there in the med spas, okay? They're like, oh, you want cheeks? You want 3 syringes? You want 4 syringes? You want more Botox? Let's just do that. I've been doing this long enough, as have many of my esteemed peers. Hopefully some of you are out there like nodding your head. Yeah, I know, Paul. Is that you really have to think ahead how the patient's going to age. I actually look at someone. Oh God, I may not say this because everyone's like, when you look at me, do you like see all my faults? No, but when I'm examining you or anyone professionally, I am picturing how you're aging, and I'm a very visual person. Not a great writer or a reader, but I'm very good visually. And I have to kind of predict how it's going to go for you. And I have to use your desires and expectations and know that. So particularly for the growing younger population that's out there, you know, when someone's 65 years old, not that they can't live to 100, but I have more to work with. When someone's younger, I have to be very, very cautious about what I'm doing. And, you know, unfortunately, there's a lot of abuses out there. Hopefully you guys will know how to avoid that. You know, I like to do things several areas of the face. Again, if you're an interior designer, you know, if you paint, I tell my patients all the time, because they think of like, oh, I want some here, I want some there. And I tell them, listen, if you paint 3 walls of a room, the last wall is going to look dirty. So if you feel me going around your mouth after doing your cheekbones, there is a reason for it. And then if they say, no, I don't want anything there, I try and work it out with them. And then I say, I may not be able to put that much in the cheek. Because again, you have to balance. There's also an issue now, you know, understandably, all my patients can't afford, or anyone can't afford, unlimited amount of Botox and fillers. So I have to prioritize on the face where to get the most out of the least. And that is a skill. Let's move down. You know, another one of my favorite expressions I like to say is I like to treat faces, not features. Okay, you don't want any feature walking in the room first. So I think that's it about injectables. I am gonna answer a bunch of questions because they haven't, but I want to get to combination treatments because to me, the expertise in my practice is in combination. Okay, I don't just do injectables. I don't just do lasers. I don't just do surgical liposuction. I do the non-invasive stuff too. And I really feel that the combination of treatments is the most advanced form of therapy. In fact, going back to work, it's going to be a little difficult now because I would say 75% of my patients that come to my office are used to getting a combination of treatments in one session. They may get a laser genesis and V-beam, they may get a clear and brilliant, and I maybe do injectables. And they may actually see several providers in my office. They may see my PA for something, my nurse for something, I'll do the injectables or a Fraxel. And to me, this is the art. And I think moving forward too, for cost efficacy and to be able to, you may not have time to go to a doctor's office once a week for 3 weeks if, with this whole COVID thing, and you want to get a few things done, you're going to want to be able to combine. And to me, I really, really think that's where the art is going to be. Now, all the questions I normally get is, can you do these things together? Okay. It depends. I can do things together. For example, any laser that causes inflammation of swelling, of course, I have to do the injectables first, right? I'll numb up the patient. Let's say I'm doing a Fraxel. I'll numb up the patient for an hour while they wait. My staff takes off the anesthesia. I do my injectables. I do my Fraxel, or other type of superficial treatment. There are some doctors who are like, oh God, I would never do Fraxel over Botox. It could affect the diffusion. I don't know. I do dozens of patients a day. I've never seen any problem of lasering over fillers causing any shifting or any increased risk of allergic reaction. That's just my comfort level. This is what I do. Other things like skin tightening things like Ultherapy or Axilla sub the face, I'm going to do that first, and then I'm going to do injectables on top of it. We often will combine Fraxel and microneedling. I'll do the microneedling, energy delivered microneedling first on the neck to like tighten the neck, and then Fraxel over it. Because again, the microneedling goes deep, the Fraxel goes more superficial. And I'm combining things often catered to the patient's downtime. Again, some of these devices have more downtime than others. So you really have to create a symphony of treatments. You have to prioritize. You have to assess the expectations, because by the way, everyone has different expectations. One person's great Dr. Frank job is another person's, what the fuck did he do to me? It's just the nature of the beast. You know what I mean? So any good doctor out there, the most important thing they could do is match expectations, because I do have patients that come into my chair and they're like, I want Fraxel repair, CO2 resurfacing. I want these lines gone. And I'm like, can we settle for dramatically improved? How about dramatically improved? Is that good for you? I can make CO2 lasers where, these people, they're giving up a week of downtime, 2 weeks with even redness, a little bit of redness. And I can make dramatic differences for tightening up skin around the eyes, fine lines here. I mean, I can actually dramatically type up crepiness of the neck. But when someone uses the word gone or, shows me pictures of other people, I really got to be cautious about the manner of which I could match their expectations. Listen, if a patient is not comfortable about something, I have to really decide whether or not it's appropriate to do it or to actually help them through it. I really have to assess the psychological component, because ultimately, after 20 years of practice, there's one thing that I really, really want, and that is happy patients. That's all I want, okay? And it tells me that they feel good about themselves. I've won. So that's great. I think this is the last major topic before I start taking questions. I'm actually impressed. So many people are still on. We have hundreds of people here. That's amazing. This is the big question, kids. To cut or to not cut? And people ask me this all the time. Dr. Frank, if I do this Botox and filler forever, I'll never need a facelift, right? Or, Dr. Frank, I definitely don't want a facelift. You got to keep putting in more filler. You got to keep putting in more filler. More Botox, more Botox. Or I'll do 10 CO2 Fraxels on my neck to tighten up, so I don't do that. And this is when I have to have the talk. And contrary to what most people think, I love plastic surgeons. I love working with them. I think there's a huge role for surgery. I think techniques are better. They're safer. There are amazing doctors out there. I mean, I work with a lot of amazing plastic surgeons, Dr. David Rosenberg, Dr. Jessica Latman, Andrew Giacono, Stephen Levine, Mark Sultan, Adam Kolker, and these are facial plastic surgeons, body surgeons. And, listen, I fully admit there's only so much I could do, and what I have to realize is that I have to be a compliment or they have to be a compliment to me, or I have to be a compliment to them, because I'm going to break the bad news for you, kids. Even if you do get a facelift, you're still going to need some Botox and filler, neuromodulator and filler. No matter how much you pull tight, ooh, that actually looks pretty good. No matter how tight you pull, don't you think that looks pretty good? Uh, no matter how tight you pull, you still got to cheat around the mouth, okay? No matter what you do for a brow lift, okay, or blepharoplasty, you still need neuromodulator. Now, you may not want that stuff anymore, okay? But, you know, again, it's grooming, guys. Even on the best plastic surgery results, sometimes we get loss of fat and facial wasting here, where we have to revolumize over time. Listen, some people don't heal well. They need cosmetic tattooing or lasering of scars. The fact of the matter is, everyone out there knows what their good hair day looks like. And we all feel better when we have that good hair day. So why shouldn't you have the good skin day if it's possible, if you have the means and the comfort? It's not for everybody. And ultimately, whether we like it or not, we are visual people. And when we have that good hair day, we feel better about ourselves. And another one of my quotes is, people confuse vanity with narcissism. And it's just not true. Vanity is, it's a sign, it's a reward for self-care. Because when you do sleep well, exercise, meditate, have relationships with your loved ones, and you do things to color your hair, put on makeup when you go out, or get a little Botox and filler or some laser research and get rid of sun damage, it feels good to take care of ourselves. And the reward is to look in the mirror sometimes and feel good about it. And again, we don't all have to look like Christy Turlington or Tom Ford. But I kind of like to look like Tom Ford. But, I just think it's a very important thing. There's a lot of things I do for patients post-op to help healing of their scars, to help with the inflammation, and to help them there. When people get brow lifts, I'll put Botox to help settle it down. There are a lot of things that can be done dermatologically and in terms of plastic surgery. And in all honesty, it makes my job easier after someone's gotten a facelift, because I don't want a bloated patient. It's a natural presumption of a patient who's been doing injectables for 20 years, and injectables been around a long time now, that if this amount worked for them 10 years ago, and then a little bit more worked 5 years after, and then 2 years later more, like, why not just keep adding more and more fillers and Botox and neuromodulator, all these type of things. And there's a time where I have to have that conversation to a patient, where I have to say to them and look them in the eye and say, we've done a great job. You look great. I understand your frustration, but if you feel that what I'm doing is a law of decreasing returns, meaning that, like, you're spending so much money, it's like not lasting long for you anymore, your face keeps sagging, or you're just not satisfied the way you used to be years ago with that small amount of injectables or laser, well, then it's time to consider plastic surgery. And by the way, it's okay if you don't want the plastic surgery, but then you're going to have a lower expectation, because a smart doctor, a skilled doctor, and a good doctor will have that conversation and will say when enough is enough. And I've had that conversation, and a lot of people who thought that they were never would consider going for surgery went, and they would come back and kiss and hug me, because they needed that honest conversation with somebody. And then there are other people who they never had surgery and they just wanted more filler, and I wouldn't do it for them, and they went somewhere else, and that's okay too. Or they just were satisfied with what they had, and they're just like, oh, it's just not for me, or I don't want surgery. Let's keep doing the best we can, doc. But you have to have these conversations. It's all about expectations. Now look at that. It's been like 50 minutes. That's like perfect. That's what we said. I think we're going to answer some questions. Oh, I want to quickly answer a question from Jolene Egra, who's an amazing beauty writer who I speak to all the time. She asked about fillers and blindness. Okay, fillers and blindness. Hypothetically speaking, and there are a few case studies in the literature, anything that you inject into the face, filler being one of them, can clot a blood vessel and cause the results of what clotting a blood vessel is: blindness, stroke, things of that nature. There are cases in the literature. There are ways to minimize it happening. Unfortunately, if and when it does happen, it is like pure lightning striking, like random. Dermatologists and plastic surgeons have been trying to figure out ways to minimize that. Fortunately, it is like so extremely beyond rare. A lot of other terrible things in life have a much higher risk of happening to you. But yes, it has to be in a consent. You know, so is getting hit by a car when you go outside. But, you know, appropriate technique is always very important, whether it comes to allergic reactions, bruising, aesthetic result. Technique is always going to play a role. Let's go over with some of these questions here. I'm going to have to put on my glasses, guys. How vital is the consistent use of retinol? It's a little skincare question. Retinol is a over-the-counter version, basically, short answer, of prescription Retin-A. It is one of the more potent and good skincare products out there. It's not tolerated by everybody, just like Retin-A isn't tolerated by everybody. So it's not for everybody. And you know, I actually, for people who want a good skincare regimen, I always include a retinol. Simple. If they can tolerate a retinoid, stronger prescription one, great. If not, retinol. Do you encourage drinking collagen or taking an oral collagen supplement? This is a great question because I've had mixed feelings about this. I used to take it. You know, taking collagen doesn't mean supplement's going to go directly to your skin, kids. You know what I mean? You're basically just taking a protein supplement. And I used to take a bovine protein supplement, so not so much for beauty or skin, but because I exercise a lot, I don't eat a lot of meat. I used to eat a lot of fish until I found out I had small amount of mercury toxicity. That's for a whole nother series on IG Live, okay? And I was taking bovine protein supplements, but my impression now is that could have contributed to my mercury poisoning. So I don't know, guys. Let's see. When you get Botox, should it be assumed that you should return within 10 days to get an adjustment, or is that rare? I inject neuromodulators all day long. I would say about 15% of patients, I just know they need a touch-up. You know, 2 glasses of wine at the same time is not the same effect as an hour apart. And there are just some people who can't just drink all the neuromodulator at one time. I can't do all 3 areas of their face. It changes their anatomy, it drops their brow, it affects their smile. Sometimes I 2-stage it, sometimes I slightly undertreat, and I universally bring them back in a week. But most patients, particularly the younger ones under 40, it's not necessary. But I tell patients, listen, if I don't hear from you, I assume you're happy. So. What procedure or filler runs the risk of making your eyes smaller? Well, too much of any filler will make your eyes look smaller, and too much neuromodulator in your forehead will make your eyes look smaller, okay? Too much filler, too much neuromodulator, less is more. And if a patient asks, put more, my other doctor a few years ago used to make it look a certain way. Well, guess what? You're a few years older, and every time you put too much neuromodulator in your forehead, it makes your eyes small, and I'm not going to do that. You have to educate people about how things change over time. And you can always bring them back. I always want to touch up. I'm always happy to touch up a patient if I give them a better result. And I include it in the price usually. If someone comes back and they want more, you know what I mean? More cheekbone, another area, another syringe or something like that, well, then it's a different story. Best way to maintain youthful, fuller lips without filler. I mean, that's a tough one. Learn to pout more, wear sunscreen, certain lip glosses that create a little plumping of the skin, or at least the appearance. You can get microblading, lip blushing, or lip liner. My cosmetic tattoo artist, Christopher Drummond, is amazing at making lips look amazing. You know, lip filler can be a little frustrating. Doesn't last that long. There is the new Restylane Kiss out, which I honestly don't think it's going to make that much of a difference in the market, but everyone's looking for longer lasting lip fingers. I tell people, stop making out and eating so much. The lip filler will last longer. The fact of the matter is, the reason why lip filler doesn't last that long is because we use our lips so much, okay? Areas like filler temple doesn't last that long because you're not flexing that area. What can we do if we can't get to New York, get to me in the next couple of months? Come on, guys, get the private jet. Come on in. No, I mean, listen, there are things, people are stuck in places they can't get to their provider. You know, do the things that you know are going to be the simplest if you're not with your usual provider, or you can do things that take safety precaution, but there's not an enormous amount of art involved. Like you could do skin tightening procedures like therapy or Sillis, things of that nature, which aren't as artistically necessary. I miss you too, guys. Thanks for joining. Any other big questions we got to get there? There's so many. I love this question. I love this question. PRP for wrinkles and tightening. PRP. I use PRP. For those of you that don't know, PRP, you draw your blood, you isolate the growth factors, hypothetically, you inject it into places. Now, I do use it for hair loss, particularly in women thinning out, because they have very limited options, and I do believe it does work. I use it in men too. And there is research to show that it does work. But for the skin, PRP, I'm just not a fan. And I'm sorry out there if there are other providers that love it. But most importantly, it's traumatic, it's not cheap, and most importantly, compared to the other modalities like injectables, lasers, and other skin tightening things out there, including surgery, I don't think it does diddly, okay? There is research, and I have used it before, sometimes in wound healing after a laser to maybe speed it up, but it's a big extra expense, and if it speeds up a week recovery laser by 1 day for an extra $1,000, I don't know. I'm trying. Some people just want it because they want it. I do have some patients where I'll do aqua gold microneedling into the face with it if they love it. But let's just say this: patient comes in for a consult. It is rarely, if ever, on my list of to-dos because I want people coming back with wows. And again, I'm prioritizing for myself too. I'm pushing people towards procedures that I know that on follow-up, they're going to be like, you rock, Dr. Frank. What else you got? Okay. And if I do PRP on someone's skin for that and charge them $1,200, that follow-up actually may not be a follow-up. So anyway, what else you got?
How to treat mid-cheek horizontal lines developed after deviated septum surgery 2 months ago.
Mid-cheek horizontal lines after deviated septum. Very difficult to treat lines here, guys, after nasal surgery or anything. This is a very delicate area neurovascularly. It is an area because we smile so much, it could shift filler. In fact, I'm very cautious with, when fillers first came out, volumizing fillers first came out, it was like everyone was filling up here and everyone was getting cheeky and their eyes smiling and filler was shifting. Fortunately now, at least here in North America, things were shifting more laterally, which I think is better. So you can put something here. I usually would recommend a cannula. You have to be very careful. Someone also asked before, what do I do about my nose that slightly gets bigger over time? Okay, that's from my boy, Dr. David Rosenberg. You need an ENT facial plastic surgeon. I'm not a big fan of nose filler. There are times, including on myself, I've got help with a little bump here, but the nose is a danger zone. And in fact, in Asia, the majority of cases, in Asia is the Wild West with fillers. The cases where there were things like blindness and really horrific reactions were really in this mid-face line, treating the glabella, treating the nose. And you know what? It's just not worth it. It's painful. It's something you have to do often enough. It's expensive. And this is a very, very difficult area. I know you go on Instagram and you see people doing non-invasive nose jobs all the time. But are you really going to do that for the rest of your life? And the chronic injections of hyaluronic acid or whatever filler you're using into the cartilage definitely breaks down and affects the cartilage over time. I think you're doing yourself a disservice by dramatically modifying your nose. And if it really bothers you so much, nasal surgery is amazing. Okay. And yes, as you get older, particularly men, your nose cartilage gets wider and it dips down. And you know why I know that? Because it happened to me. And that's why I went to go see my buddy, Dr. David Rosenberg, who shaved down the cartilage and lifted the tip. And now my nose looks like it did when I was in my 20s, which is really all I wanted. So simple procedure. You don't have to break bones. You wear splint for a few days and that's it. Keep it simple, stupid. Remember, kids?
What do you mean by skin booster?
What is a skin booster? Skin boosting started out in Europe. It's a way of micro-injecting neuromodulator and filler hyaluronic acid. Again, hyaluronic acid is a sugar found in the skin that absorbs water, so it gives hyperhydration, and it's a skin booster. So by using the combination of the filler and the Botox, microneedling in, it gives this boosting plumpness to the skin, a hydration, a shine, a firmness, and that's what skin boosting is. We're going to take maybe 1 or 2 more questions, guys. I can't believe all these questions here.
I want to know about threading for lower face or neck. What do you think?
Threading. I like threading. There are a couple of different types of threads out on the market. This is my deal with threading. They're not a facelift. I like using threads once someone has maximized the architecture of the face, meaning with neuromodulators and fillers. And then, if they're looking for a few millimeters more of a lift, and A, more injections will just make them look stupid, or B, they're unwilling to go to surgery, that's when I use threads. And again, you're talking about just a little lift. They're great. I tend to use the Nova or the Euro threads. They go in very easy. Downtime is like nothing, a day, max, 2 days. And they do make a difference. And they dissolve over, several months. Results could last a year, 2 years. I could occasionally put in more threads as I do filler. You can't do certain type of skin tightening treatments with them in the face, but you can do lasers on top of them and you can combine it with anything. So I do like threadless. Just to preemptively hit a question that's going to come up, I'm not a big fan of them on the body. These strings are not made of steel. They're not tightrope. They're not lifting butts. They're not lifting knees, things of that nature, but I do like them. How do I like to treat broken capillaries around the nose? Oh boy, I got like 4 lasers for that. I got V-beam, I got Genesis, I got XLV, I got, I don't know, I got so many other things. There's no best. Unfortunately, I wish I had one laser for everything, but it doesn't work like that. Sometimes I'll combine. I had, let's see, how to treat stretch marks. That's a body stuff. I love Fraxel and microneedling. What kind of results can be expected from dual Fraxel? I mean, dual Fraxel to me that's like the Botox of lasers. It's just like, there's no one in the world that can't benefit from a Fraxel. I think for myself, getting it once a year has done the absolute most for my skin quality. What do you think? I've had my day in the sun. I'm an outdoors person. Texture, brown spots. Who needs that? Bad texture and brown spots. I think Fraxel's great. It's a great combination with any treatment. One more question. It's 5:35, guys. I can't believe you're still on. I love it. Let's see. Do skin tightening lasers cause fat loss? This is a good question. People are worried about, will my face fat be destroyed? Will my fillers be destroyed if I do skin tightening? I think that's a myth. I use alt therapy on all my filler patients. I think if you use any technology wrong, you could develop scar tissue that causes lipoatrophy, meaning fat loss. If you overheat any portion of the skin anywhere on the body, you could cause fat loss. But if technologies are used appropriately and combined appropriately with other modalities like injectables and so forth and so on, I really don't see a high risk. I've never really experienced something like that. And guys, it's 5:30. I think my first webinar went pretty well. How about you? Could you show me some claps? I'm very insecure. Can you give me some claps maybe? Do you do emojis over there? Anyway, I got a lot to say, as you know. You got to follow me at Dr. Paul Jared Frank on Instagram and all social things. And I hope you become part of the PFRANKMD family. I'm not going to run out of things to say. And I love what I do. I love my patients. I love talking to all of you. This is what makes me passionate. And man, I'm so happy to not have COVID and to be healthy and be going back to work. And I am very blessed. And that is the biggest asset I have to feeling beautiful. So I hope you are all blessed with the same thing. And I thank you all for joining. I'll see you on social or in my office. Peace.